Florida's Democratic Congressman Debbie Wasserman Schultz joins us live. Congresswoman, good to see you. The Republicans put forward something, a pledge to America. May have lacked some specifics. Why can't the Democrats put forward their pledge or what they're going to do if they were reelected to a new Congress?
Well, because we're in the midst of doing it, and unfortunately without the cooperation of the Republicans, but we have a solid record to run on, and we are going to continue to press forward. If we're fortunate enough to return to the majority, that we'll continue to push to move the country in a new direction, focus on the job creation and expanding our tax-cutting policy to assist the middle class and working families and small businesses. We're going to continue to implement the health care reform law and make sure that we can continue to keep patients, put patients in the driver's seat as opposed to insurance companies. And there's a very stark contrast that was laid out in the pledge to special interests that the Republicans rolled out yesterday versus the protection for consumers and standing up for the middle class that we've been progressing on.
I hear you're saying that there's this stark contrast, but perhaps the voters don't yet see that stark contrast. I think you would acknowledge that. And Bill Clinton yesterday said that the Democrats need to be more vigorous, was the word that he used about presenting their ideas. Just listen to what he said.
I think that the Democrats ought to put on one card, no more than 5 and no fewer than 3 things that will be their priorities. We've still got a chance here. I know how easy it is to lose control of the debate. It happened to me in '93 and '94. So I think that the president and the Democrats, even at this late date, should view this as an opportunity and an obligation to say, all right, they've organized their national plan. Here's what ours is.
Here's what ours is. You heard the president right there. If you've got your little card, then, Congresswoman, what are those 3 to 5 things? Real quick, tick them off.
Well, focusing on providing tax cuts to small businesses, the middle class, and working families. Making sure that we can balance helping businesses to thrive with focusing on deficit reduction and not having our tax policy explode the deficit, which is the difference between the Republicans and the Democrats' policy. Focusing on trying to implement the health care reform legislation so that we can continue to close the donut hole, implement the patient protections that kicked in yesterday, take insurance companies out of the driver's seat and put patients back in control of their own health care, and shift the health care system from a sick care system to one that focuses on wellness and prevention. I mean, that's just to name a few on top of what we have already accomplished, which is the most significant legislative record in history by most people's accounts. Wall Street reform, health care reform, turning the economy around, which was bleeding 750,000 plus jobs a month to now adding 100,000 private sector jobs. We've made a lot of progress, but we've got a long way to go, and we want to make sure we can continue to push forward for that change.
Well, you've seen, I don't have to tell you, Congresswoman, the polls out there that suggest there's still about a majority of Americans who don't like Obamacare. But there was actually an Associated Press poll yesterday that showed, in part, because there's still a lot of misconceptions about the health care reform. 52% think that they're going to pay more in taxes. Only 38% say no change in taxes paid. And actually, a lot of people also thought that it would be a budget buster when, in fact, the nonpartisan CBO has said that actually health care reform would save over $100 billion. So why have the Democrats failed in communicating Obamacare, health care reform?
Well, first of all, you're helping us, the Republicans, by playing right into their hands and calling it Obamacare in the first place. It's health care reform. Let's make sure we call it by what it is.
I understand that's but it is the president's health care reform.
So let's not use their terminology.
Okay.
Yes. Our signature proposal is one that just yesterday kicked in the Patient's Bill of Rights. For example, it makes sure that we no longer allow insurance companies to drop you if you're sick. It makes sure that children are not going to be denied coverage based on a pre-existing condition, that young adults, this kicked in yesterday, young adults can stay on their parents' insurance policy until they're 26. We really do need to spend more time educating Americans about what the reforms do and how they benefit them, but particularly in terms of it's the most significant deficit reduction that we've ever passed out of the Congress. Over 20 years, $1.3 trillion in deficit reduction, and in addition to that, significant tax cuts for small businesses on their health insurance premiums that they pay for their employees.
All right,
We got to
Congresswoman Debbie.
make sure we get the word out to people. You're absolutely right.
Congresswoman Debbie Wasserman Schultz, good to see you. Thanks so much. We appreciate you joining
You too,
us.
Nora. Thank you.
And developing now.